Start.
Myself, Dr. Devraj Depurgaisto. I am ICU head, Divine Nursing Home. So, as you all know, the current situation with COVID-19, where we are standing right now. So, day by day, the cases are increasing. So, everybody is panic, the number is going high. But one thing, what we should highlight is that though the numbers are increasing, but a large number of people also have gone home. That means they have become cured of COVID-19, that is coronavirus disease. And if we look through the patients who are actually admitted in our hospitals, the fatality rate till now in our country is less. So that is the reason the death numbers are also not comparatively that high as per the number of cases. Now, one thing we should remember that this COVID-19 is just another virus which has been added up in the family of virus. So, it is not going to go very fast. I think this virus is going to stay for a longer period. The few countries are already in the process of getting the vaccine, and almost a lot of work been done for preparing the vaccine. Same way our country, Serum Lab is also working with Oxford to prepare the vaccine, that is ChAdOx. So the animal trial has completed, now the human trial has started, phase 1 is going on. So if everything goes fine, then probably by October end, as per the research work is going on, we might be able to get a vaccine. So now, why vaccine? Because of this virus, probably we have to deal with in sort of prevention. So if we look at the temporal history and profile, so all viral illnesses, basically, we know that there are no specific treatment or definite treatment for the virus, so it's only prevention. So for that reason, there are a few guidelines which has been advised, and regularly we are telling to all. These few guidelines we have to maintain, and I think we have to maintain it for life. So number one is social distancing. It's actually not social distancing, it's physical distancing. So you should maintain that 6 feet distance to prevent the transmission of the virus. Then do not touch your nose and mouth. That is another thing. You should wash your hand properly 20 seconds every time you are touching a surface. So that means either with soap water, which is equally good, or alcohol-based sanitizer. So these three things is very important: distancing, physical distancing, wash your hands properly, and do not touch your nose and mouth. Also, the guideline has come for the use of mask. So I think we have to use the mask. Now there are a lot of confusion in the mask. See, the people who are going around, so they can use a normal cloth mask, which is equally good, but the people who are coming to the hospital, I mean the area where the patients are there, then preferably a triple layer surgical mask, and the people or the healthcare worker who are going in close contact with the aerosol, they should wear a N95 mask. So main thing is that this virus, if we do all these precautions, then probably we can prevent transmission, because this virus, as I told, it has become added up in our family of the virus, and we have to live with that virus. There are some data coming on between, transmission between animals to human or human to animals. So recently one data has come where they have said, the study has said that human-cat-human transmission. So they have documented the cats can get the virus from human, and then again the cats can transmit the virus to the human. So this is the pattern of this virus. It's frequently changing. There are a lot of new symptoms which has been discovered. So because it is changing its pattern, so that's why it will take some more time to know about this virus, and then probably we can come to a conclusion that whether this virus, is there some medicines which can help. There are a lot of medicines which has been talked, hydroxychloroquine, then again now there is doubtful Then there is another antiviral which has come, is Remdesivir. So again, it's not a clear-cut documentation. So basically, if we look at this disease, it is only prevention, prevention, and prevention. So that is how we can actually beat COVID-19. Thank you.